I see you 7 years after our lumbar fusion, OLLIF fusion. You were one of my early patients that I did the OLLIF procedure.
Yep, correct.
When was our procedure done?
In April 2013.
Okay, so 7 years ago.
Yep.
Now, what were your symptoms before the surgery?
So incredible pain in my lower back. I couldn't sit for more than 5 minutes. In the car was even worse. I pretty much was in tears if we had to be in the car for more than 15 minutes. It hurt so bad.
1 to 10, what would you number it?
In the car, I was at a 9.
9,
it was
okay.
excruciating.
Wow.
Sitting like at my desk for work was uncomfortable. I mean, I was in pain all
Miserable,
the time.
huh?
Yeah.
For how long?
Probably over a year.
And then we investigated it and we noticed that the bottom two discs are in a really bad shape.
Right.
And we fixed that in the hospital in Alexandria, actually. You're one of my early OLLIF cases. We explained that with the surgery and we decided we want to do that. Now, I'm going to first look at the pictures, and here we see that, this is now from this year, that the bone is solidly growing, very solid bone growth. And I'm going to as well go to the data of the surgery because we meticulously gathered these data of the surgery, even from day one. I see that we lost 100 cc of blood, which is nothing. This surgery easily can lose 1,500 cc of blood. And you stayed 3 days in the hospital, and your surgery was 153 minutes, almost 3 hours. One of the factors was your bone was so hard that I bent lots of those needle to get into your bone, but still, that's still significantly longer than what we do now. Our average time now for 2-level, I just did one. It was about an hour. So we have come a long way because we have maximized the protocols to what to do, and as well we have refined the instrumentation. But as well, you stay 3 days in the hospital, and these days my patient go home same day or next day. It's extremely rare. I did a 3-level on elderly patient yesterday. They're going home today, 3 levels, and that's so we have come a long way. We have really refined the protocols. But tell me about your experience after the surgery in the hospital and afterward.
Yeah, so they got me up right away after. I remember that.
Same day?
Same day. They had me walking in
Okay.
the hallway, which I thought was crazy, but I was. At home, it was a quicker recovery time than I
How long after the
anticipated.
surgery were you on narcotic?
Was I what?
On the narcotic pain medication?
I think like a week maybe I had it available
Okay.
to take. And
Then did you go back to your regular normal life?
Probably it's 2 weeks.
2 weeks,
It's back
okay.
to,
So even with the early result and less experience, you still were way ahead of open old-fashioned surgery.
Right.
Because open old-fashioned surgery is 4 to 5, even 6-day hospital stay, 1,000 to 1,500 cc of blood loss, and at least 2 to 3 months recovery and return back to regular life. So that is what attracted me to continue, and this and refine it. So to a point that people in your situation now get that surgery as a day surgery,
yeah.
and with our average blood loss is now 70 cc, so not much different, but still a fraction of the very small fraction of the open surgery. But as well, return to work as well. As you mentioned, is within weeks rather than months.
Yeah.
Now you're coming back. Why are you coming back?
I have lower pain in my SI joints.
Yeah, and we did injections there. What was the
injections.
result of the injections?
They were helpful for 2 to 3 days. I felt relief.
And I want to go back to that model there with you and show that, what we did fuse the bottom two discs, and it seems that area is growing well and your pain is different now. Is that
Yeah,
correct?
it's different.
And the sacroiliac joint is what connects our sacrum to our pelvis from the front and back. And it is, so to say, the adjacent segment to lower lumbar spine. So the symptoms sometimes can be even similar. The way we first diagnose it, we go to this part of the joint here, and by going to this part of the joint and numbing it up, if that's a problem, pain goes away. So can you tell me where your pain was and how did the injection work for you?
So my pain was in my lower back and into my thighs and
Mhm.
sides, and the injections were right on the lower part of my back. And the pain, it felt better for 2 to 3 days after, or 3 to
Mhm.
4 days. And then it slowly kind of crept back up.
Yeah, yeah.
to how it
No,
is.
and that's the idea too. This is a diagnostic test. You know,
Mhm.
some of my patients are expecting for the pain to become permanently or longer gone,
Mhm.
but that's a typical kind of what we are expecting if that's a problem for result of the sacroiliac injection. Now, we have a new method of fixing the sacroiliac joint, which is as well a day surgery by putting 2 screws across. This is one of those disease that has really revolutionized our understanding of the problem in the lower back. As a matter of fact, for a long time, it was for us, even hard to believe that this disease exists. But now we have enough evidence to say that 23% of the time when people have lower back problem, the problem is actually sacroiliac disease.
Mm.
And if you had a previous surgery
Mhm.
and have again lower back pain, 43% of the time that's sacroiliac joint. And now we have truly fantastic options for that, and all the
Mhm.
data actually support that.
Mhm.
So these days, this is a good problem to have because we have good solution for it.
Right.
Now,
Yes.
but what are your limitations with your sacroiliac joint? What is it? What's causing you mostly pain? Can you describe?
Sitting.
Sitting,
Back
okay.
to sitting.
How's sleeping?
Sleeping's okay.
Mhm.
Before I started the injections and had those that get more relief and
Mhm.
physical therapy, but yeah, sleeping on one side and then waking up and then having to flip to the other side.
Yeah, yeah, and that is something I hear a lot from my patient, and that's something people need to pay attention. Many of them, they are telling me that in the night when they turn from side to side, that wakes them up.
Yeah.
And that sort of pain gets worse, and that twisting motion in the pelvis
Right.
seems to be a problem. Was it the same with you?
Yeah, that's
Okay.
what would wake me up. I would be uncomfortable, or I would feel it on this side, and then I would
Yeah.
flip over, and then it would feel a little bit better because
Yeah.
that
How
side
are
was-
stairs?
Stairs actually have never really been a problem
Okay,
for me.
okay.
I only take them one at a time. I don't know if I
Yeah.
take them 2 at a time, it'd be worse.
Yeah,
But
yeah.
the stairs haven't a problem.
Okay.
But the sitting in the desk, sitting in the car,
Mhm.
those kind of things.
No, I didn't see you for many years
Mhm.
after our first surgery. Now, first of all, how were you doing in that time frame? And literally, when did the pain in the sacroiliac joint become so significant that
Yeah. I
we're
would,
seeking the solutions for it?
yeah, so after my first procedure, I
Mhm.
mean, I'd say the last 7 years have been terrific. Like, I could sit. I mean, I didn't
Mhm.
have any problems. It was wonderful.
Mhm.
And then February, March is
Of
when-
this year?
Of this year.
So just about
2020.
5-6 months, something
Yeah,
like that.
started to get uncomfortable, and I thought,
Yeah.
oh no, what if my fusion is doing something? I better go see a doctor.
Yeah, well, I
Abbasi.
can tell you that the fusion is fantastic. As a matter of fact, I remember your surgery especially well because of your hard bone and some configuration of the bone that is unusual.
Mhm.
It was very hard to get into the bone, and there's a specialized instrument, we call it Jamshidi, we get it to the bone. I bent 7 of that to get your, which is good for you, meaning you have good bones. But still, that made it, so that is one of the reasons the surgery took 153 minutes.
Mhm.
But at that time, we were about 2 hours, or a little more than 2 hours for similar surgeries.
Mhm.
Well, any other question you would like to ask or comments?
Yeah,
No?
I would recommend it.
Yeah.
It was the best thing I ever did
Yeah.
to get rid of my pain. Yeah,
Well,
definitely.
Well, thank you so much for
You're
the
welcome.
interview.